vaginal microbiome and vaginal health. That's something that I think not enough people talk about. I mean, we talk about it clinically, but it's not a topic that I've talked about a lot on the podcast. It's something that you have educated people for so long about in our space about vaginal health. Can you talk about that? Like, what should people know when it comes to vaginal health?
Oh my gosh, this is so important now. And, only in the past few years, and maybe not just in less than the last decade, have we had tests to look at the vaginal bacteria
Hmm.
and then really identifying that the predominant bacteria within the vagina is lactobacillus, predominantly lactobacillus crispatus. And so now that we have this knowledge, we can look at clients who've had recurrent vaginitis, urinary tract infections, discharge, odors, all of these you things that really impair our quality of life when it's not healthy down there. And honestly, that's the most important real estate of our body. So when it's not healthy down there, it is not a good day, right? It is
Hmm.
just not a good day.
Yeah.
And so being able to look at this microbiome, and what's really important is as we age, so from our, mid 30s onward,
Hmm.
there's changes to the vaginal microbiome. We start to go from a very acidic pH, which is protective. Imagine acidic vaginal pH makes sense because you want to avoid,
Yeast overgrowth. Yeah.
bacteria, but
Yeah.
right, you want to viruses, etc. So you got to keep that vaginal pH very nice and acidic. But as we age, it naturally becomes more alkaline. Also, on birth control pills, it becomes more alkaline. So
Yeah.
that's decreasing your defense mechanisms. And as we age with less um, acidic, so more alkaline vaginal pH, you're more susceptible to bacterial vaginosis, that fishy odor smell, and infections and cervical cancer. And also, the vaginal bacteria goes from being very focused on lactobacillus to very diverse. And it's the
Hmm.
opposite of what we want in the gut, which blew my mind when I learned this. So in the vagina, you want a very, very specific strains, decrease diversity. And in
Hmm.
the gut, you want more diversity. But as we age, more diversity, more prone, and we're more prone to infections and cervical cancer. So
Hmm.
it is so important to address vaginal health. I say it is key to optimal health.